Hello, smokers, alcoholics, workaholics, people with diabetes and blood pressure. Did you know that 1 in 10 people worldwide suffer from kidney-related disease? Who better to educate us about kidney-related ailments than Dr. Nikhil, Senior Consultant Nephrologist at NU Hospitals, whom we have with us today.
Hello everyone.
I have a few questions for you today. Do kidneys function like water purifiers?
So this is a big misconception. Commonly people think that the only function of kidney is to purify the blood and produce urine. What I would say, that is the least of the functions of the kidneys. Kidneys not only purify the blood, they also regulate our blood pressure. They help making certain essential hormones like for calcium and vitamin D synthesis. They keep our bones strong. Apart from that, it also helps to synthesize hemoglobin, our blood. So kidneys are one of the essential organs to keep our blood up and our hemoglobin up. So all these other functions are carried out with the single organs, kidneys. Major function is with the help of kidneys only.
Doctor, we've heard that kidney-related ailments are generally silent. People get to know that they have severe form of kidney-related ailments very late in the journey. Is that true?
So sometimes patients with kidney disease may not have any symptoms at all, and incidentally they may detect it on blood reports or urine reports. Sometimes patients can have certain symptoms which everyone should look out for. These symptoms may include like swelling over the feet, some change in the character of the urine, some bubbles in the urine they may find, BP going up, hypertension requiring more BP medications, some loss of appetite, nausea, vomiting. These are the early symptoms of patients having kidney disease. But we need to be careful. Many of the times patients may not have these symptoms. It may be incidentally picked up on blood reports, urine reports. Another thing is that kidney disease usually goes through stages. We call it as chronic kidney disease or CKD. So CKD is a kidney disease which is usually present for more than 3 months in duration. So any kidney disease which is there for more than 3 months, we call it as chronic kidney disease or CKD. CKD goes through several stages. We have stage 1, 2, 3, 4 and 5 based on the filtration function of the kidneys. So usually when the patient reaches to stage 5, which is the final stage, that is the stage when patients may require dialysis. So patients should be aware of the symptoms, and if they have any symptoms or any changes in their blood reports or urine reports, they should consult their nephrologist at the earliest.
Okay, so a sure short way to find out, apart from having a healthy lifestyle, is preventive health checks periodically,
Exactly.
right?
Correct.
So that was very useful. So how are these kidney-related ailments diagnosed?
So kidney diseases usually are detected with the help of blood and urine tests in the initial stages. So we use one blood test which is called as serum creatinine. We use this test to detect kidney diseases. Generally the serum creatinine is less than 1 milligram per deciliter. When it is more than 1 to 1.2 milligram per deciliter, something is happening with the kidney. Some disorder is happening with the kidney. What exactly is happening, we don't know. That is found out subsequently with urine test and ultrasound. So one blood test is required, then other thing is a urine test. Urine gives us an idea whether there is any protein leakage in the urine, whether there is any infection going on in the urine, we get an idea. Apart from this, some additional supportive investigations are required, like an ultrasound abdomen. So ultrasound gives us an idea what is the size of the kidney, whether there is any block in the kidney, whether there are any stones in the kidney, any infection, any swelling. It gives us an idea. Even after all these extensive investigations, the cause of the kidney disease is not clear and the disease is of recent onset. Sometimes we also do a kidney biopsy. Kidney biopsy basically means we put in a small needle into the kidney and take out a small tissue sample and see it under the microscope and see what exactly is happening, how to treat it, what is the disease and how reversible it is. We get an idea. So these are the tests. So the basic tests are blood tests like creatinine and urine test, and then advanced tests like scanning and biopsy.
Okay, that was very informative. So we've seen these ads, smoking causes cancer. We all know that. Does smoking also cause kidney-related ailments? Does cancer also affect kidneys?
Smoking definitely affects kidney diseases, and it causes a faster progression of kidney diseases. So what we understand is that smoke basically contains nicotine and tar. This basically blocks the small vessels of our kidneys. And when these small blood vessels are blocked, the kidney disease worsens and the creatinine also goes up. So one thing is it directly leads to kidney disease. Second thing, for patients who already have some kidney disease, it leads to faster progression of the kidney disease. The creatinine goes up very rapidly. So that is the one aspect. The other thing is smoking predisposes towards several cancers. We know throat cancers, lung cancers, stomach cancers. Smoking can also lead to kidney cancers as well. So when we have many patients who come to us, they have a long history of smoking and they come with a mass in the tummy, they come with a mass in the kidney, and then they have to be surgically operated for that. And they also require chemotherapy and advanced radiotherapy also. So we have to be very careful, both from the point of view that smoking can accelerate the kidney disease and can predispose towards cancers as well.
So it's lifestyle, genetics, everything.
Exactly.
Are you hypertensive or are you diabetic? Do you know it has a direct impact on your kidneys? Let's hear more about it from our kidney specialist.
Diabetes can affect the kidneys, and high blood pressure can also affect. In fact, world over, the most common cause of kidney disease is considered to be due to diabetes only. So diabetes affects the kidneys in various ways. It can affect the filters, it can cause infections, urinary tract infections, and it can also lead to stones also. One of the important facets of treatment for patients who are having diabetes and kidney disease is tight control of sugars as well as blood pressures. And how do you detect diabetes affecting the kidneys is by a simple urine test. If you do a urine test, if there is any protein leakage, we get an idea that possibly the kidneys are getting affected by diabetes. Regularly, periodically checking your sugars, checking your HbA1c. One more important thing that is to be checked is the retina. Most of the patients are not aware that diabetics are supposed to get their retina checked up at least once a year. One of the reasons is that this disease, diabetes affecting the eyes, is usually silent. It does not have any symptoms at all, and one day suddenly it can cause vision loss. The other aspect is that kidneys and eyes have got a connection. If diabetes is affecting kidneys, same times it will affect the retina also. And we get an idea that possibly sugar is causing kidney problem also. So ideally, all diabetic patients once a year should get their retina checked up. They should check their urine for any protein leakage and periodically keep a watch on their sugars, keep their HbA under diet control, and this will help them prevent from getting any kidney diseases in the future. Apart from diabetes, the other aspect is high blood pressure. So high blood pressure also affects kidneys. So we need to understand that the heart is pumping blood, and with such a high blood pressure, it is going to the kidneys. When with such high pressures, the blood is being pumped to the kidneys gradually start failing. So that's why blood pressure control is an important aspect of treatment. For patients, those who are on BP medications, they should regularly take their BP medications. For those who actually have their kidney disease, whose creatinine is high, and have high blood pressure, they should control their blood pressures very strictly, ideally less than 130/80. That should be the protocol.
A regular consultation with your kidney specialist becomes very, very inevitable in case of hypertension and diabetes, you're saying.
Correct.
Engine failure means new engine. So does kidney failure mean new kidneys?
Yeah. So when our kidneys fail, the final treatment remains either dialysis or transplant. So as we discussed earlier also, kidney disease goes through stages. So stage 5 is usually when the filtration function is less than 15%, both the kidneys together. So at that stage, usually patients may require dialysis. Dialysis basically means purification of blood. As we discussed earlier, the function of the kidney is to purify the blood and produce urine, but kidneys are failing now, so something has to purify the blood. Right. So dialysis does that work. It is basically a bypass mechanism. So in general, we have got two types of dialysis. One is called as hemodialysis and one is called as peritoneal dialysis. Hemodialysis basically means that a patient has either a catheter in their neck or they have a working fistula in their arm, and they go to a dialysis unit at least thrice a week or twice a week. They take 4 hours of dialysis and then they go back home. This is called as hemodialysis. The other form of dialysis is peritoneal dialysis. So in peritoneal dialysis, a small tube is placed in the tummy and a glucose solution is run through into the tummy. Internal dialysis takes place, and then after 4 to 6 hours, the fluid is then thrown out, eliminated out. With that, all the toxins, creatinine, urea, uric acid, all that is eliminated. Right. So this is called as peritoneal dialysis. So these are two forms of renal replacement therapy or dialysis modalities. And the final treatment for all patients on dialysis or those who are reaching the stage of dialysis remains kidney transplant. Kidney transplant means that if a patient has a potential donor a living related donor or dead body donor, dead body transplant, cadaver transplant, they consent to give the organs, and so one kidney is selected and transplanted, and the new kidney takes up the function, and the patient recovers from the operation and starts working well and does not require dialysis thereafter.
A normal life.
Correct, exactly.
Wow,
so
fantastic.
that is the beauty of a kidney transplant, a new life, a beautiful life of dialysis, and they can lead a normal life just like regular individuals.
Both the donor and the recipients can lead normal life.
Exactly.
Fantastic.
So both the donor as well as the recipient, they can lead a normal life with a good working kidney.
Oh, that's really good to know. Okay, one more lifestyle related question, doctor. I'm a couch potato, a very sedentary lifestyle. So is it affecting my kidneys constantly?
When you have a sedentary lifestyle, when you're not working out, when there is very minimal exercise in your life, when your work schedule is so tough that you're always on your desk, you have a predominant desk job, and there is no exercise at all, you're piling on weight, you're piling on calories, that can slowly affect the kidneys' function. One important thing what we need to remember is that the excess body weight or obesity basically puts extra pressure on the kidneys, and when that happens, the kidneys have to bear the brunt, and gradually the function goes down. So for patients, especially if they are obese, those who don't have much of active lifestyle, those who don't have much of physical activity in their life, those who are diabetics, such patients ideally are recommended to have at least 30 minutes daily of some moderate physical activity like walking. They should try to reduce their weight. This is not just to reduce weight, this is also to help improve the kidney functions also. We need to understand that we are burdening the kidneys, and when we reduce weight, the burden also comes down. The kidneys function also shows some improvement. So that's why weight reduction is very essential for all patients, especially those who are obese.
So an ideal weight would also mean that less burden on kidneys.
Correct.
Is what you say. We all know prevention is better than cure. How is it that we can prevent kidney diseases?
So in this context, what I would try to explain to you is, one thing is regarding diet and physical activity that we already discussed. Our diet should contain fresh fruits and vegetables, and as much as possible try to avoid processed food, junk food, because all that essentially harms the kidneys on the long run. Then adequate fluid intake, hydration. So we need to understand that too much of water intake will not help the kidneys. It is not like that. Too less of water intake, that is also not true. So we should
2
keep
liters, 3 liters of water, is that a myth?
So that is all a myth actually. Ideally, if a person drinks around 1 to 1.5 liter, at the most up to 2 liters, that is usually sufficient for a body. That is usually sufficient for the kidneys. Drinking too much of water and thinking that it may help the kidneys is completely untrue. It's a myth. So people should not do that. Otherwise, they become overhydrated. If a patient already has some underlying kidney disease, if they drink 3-4 liters, they'll develop swelling, some breathlessness. All those problems can rise. So 1 to 1.5 liters is usually sufficient for our kidneys, for our body to function. Depends upon the situation also. For example, a farmer who is working in the field, they may require a little bit more water intake, a little bit more fluids, like around 2 to 2.5 liters. People like us, or for office going people who are having a desk job, who are working in the AC, they are not very much dehydrated. In such cases, 1 to 1.5 liter is usually sufficient. So that is with regards to fluid intake. Apart from that, if you have any comorbidities, like if you have sugar, control of sugar and BP is very essential, because controlling that will help you from preventing kidney diseases in the future. That is the third part. Then the fourth part is regular testing. Patients especially who are diabetics or who have got high blood pressure, they should at least get once in 6 months or once in 12 months, they should get their blood pressures, they should get their creatinine checked, they should get their urine analysis checked for any protein leakage, cholesterol is to be checked. So all these parameters, at least once in 6 months to 12 months, they should get it checked. This is very essential. This is also true for patients, for people, those who have got a family history. For example, if I don't have diabetes today, but my parents have got diabetes, we have a strong family history, there is always a risk of developing diabetes or high BP later on in life. So if you do a preventive health checkup regularly, at least once a year, we'll get an idea that whether we are developing sugar or whether we have any risk factors for developing kidney disease later on in life. So this way we can catch the disease early and prevent it from further progression.
So healthy lifestyle, ideal diet, and preventive health checks.
Correct.
The three mantras to prevent kidney diseases.
Yeah.
We all know that blood pressure and diabetes can only be managed, cannot be cured. Is it the same for kidney related diseases also?
We need to understand that kidney diseases are basically typed into two types. There is something called as acute kidney injury or AKI, and there is something called as chronic kidney disease. So chronic kidney disease is a disease which has been going on for a long time. Technical definition is when a kidney disease is more than 3 months. We call it as chronic kidney disease. So when the disease becomes chronic, CKD, that time we understand that the disease has become irreversible. It will not come back to the normal, but at least we can make it stable or keep it stable for a pretty long time with medications and manage it. The other aspect is acute kidney injury or AKI. So acute kidney injury is basically a condition, a kidney disease that has just recently happened within a couple of days or a couple of weeks or so. For example, I had a patient yesterday in my OPD. He had some knee joint pain and he had taken some painkillers, over-the-counter painkillers. And after that, he started noticing some swelling over the feet. He was educated. He thought that it may be due to kidney disease. So he got himself checked out and his creatinine was found to be around 2 milligram per deciliter, which is abnormal. 2 months back, he had checked it and it was completely normal. It was 0.9 milligram per deciliter. So when he came to us, we found that his blood pressures were high. He had swelling over the feet. His creatinine was high. His urine was also showing some abnormalities. Right. So what we understood from his condition is most likely the painkillers may have caused this acute kidney injury for him. So in such cases, when some medications cause acute kidney injury or if some infection is causing acute kidney injury, usually these are reversible. They may revert back to the normal self. For this patient, like for example, I gave this example as patient, stopping the offending medication, the painkillers usually is the treatment. So I've asked him to come back after 2 weeks or so. Usually in such cases, majority of the cases, the creatinine comes back to the normal level once the offending medication is stopped. So that is the difference between acute kidney injury, which is usually reversible. It comes back to the normal level. But in cases of chronic kidney disease, usually it is there for a long time and the damage has become irreversible. We cannot reverse it, we cannot normalize it, but at least we can manage it with regular visits and with medications.
So as doctor said, definitely no over-the-counter painkillers, and if you see any symptoms of kidney-related ailments, please see a nephrologist, a kidney specialist immediately. Okay, doctor, what is the life expectancy of a person with CKD?
The life expectancy of a patient who has underlying chronic kidney disease is definitely shortened because we need to understand that kidneys are vital organs and gradually they are failing. So when one organ of the body is failing, gradually the lifespan also gets shortened.
Correct.
Like for example, as I told you that the kidney disease goes through stages, and once the patient reaches to the stage of dialysis, the lives are shortened. They generally succumb to either heart diseases or due to infections and so on and so forth. So in such cases, what generally prolongs the life is a kidney transplant. Research has shown, studies have shown definitively that a patient who has undergone a kidney transplant, they live much, much longer as compared to a patient who is on dialysis. Kidney transplant should be the way to go.
So the solution for a person with CKD and who is on dialysis is transplant, definitely.
Final solution is transplant.
Correct, yeah. And even for the donor, the life expectancy remains normal.
Yes.
And for the recipient also, the life expectancy increases.
On an average, the life expectancy of a patient who has been transplanted is roughly around 25 to 30 years, whereas for a patient who is on dialysis is roughly around 5 to 10 years.
It's 5 times.
Yes. Exactly. Fantastic. One more thing that I would like to add is research has shown us, there are several studies to quote also upon this thing, that donors who donate their kidneys to their loved ones, to their relatives, they donate a part of their body to their loved ones, they live a longer life as compared to those who do not donate. This is very interesting. The reason behind this has been found is because the donors, they undergo extensive evaluation before the transplant process. They undergo a lot of tests and everything to make sure that they are fit for the process. And during that time, if there are any small diseases or anything, they are picked up at the early stage. Disease gets detected earlier on and then they are treated also earlier on. Okay. So that is why they live, on average, donors live a longer life as compared to those who do not donate their organs.
Donate organs, give life. Thank you so much, doctor. That was a very immersive, informative session today.
Thank you.
So one last message from the doctor's side to everybody who's watching us today.
One last message that I would like to give to all our viewers is that please be careful about your diet. about physical activity. Regular physical activity is essential. Those of you who have got diabetes, those who have got high blood pressure, please get your blood test done. Keep your sugars under tight control. That is very essential. Get your eyes checked up. That is very essential. Apart from these tests, please do your serum creatinine and urine test. One thing that I would like to emphasize is many patients or many people, they focus on creatinine. I need to emphasize is that urine is the first test where some abnormalities are picked up. Afterwards, the serum creatinine begins to rise. The most important test that all patients should do absolutely is a urine analysis test. Check if there is any protein leakage in your urine, if there is any sign of infection. And after that, creatinine is very essential. Those patients who have got very high blood pressure, please keep your blood pressures under check, ideally less than 130/80. Reduce your salt intake. Please participate in physical activity. Please do not take any over-the-counter painkiller medications because that can affect the kidneys over a long period of time. And in case if you develop any symptoms like swelling over the feet, you notice a change in the urine consistency character, frothing you're noticing, or any redness is there in the urine, please immediately consult a nephrologist.
So people, healthy lifestyle, good diet, frequent visits to the doctor for preventive health checks, and watch out for symptoms. And if you see any kidney related symptoms, kidney disease related symptoms, please see a nephrologist, a kidney specialist. So wasn't that a very insightful session that we had today with Dr. Nikhil, who's a senior consultant nephrologist at NU Hospitals? I'm sure all of you have benefited from the information that he all imparted today. So I'll be back again with another interesting episode very soon. Till then, signing off, this is Sahana Pai.
Thank you, and please take care of your kidneys.